This project is very personal to me when it comes to talking about what ADHD is, and whether or not you commit serious crimes as a result of or despite ADHD. It's difficult, I suppose, when you are actually personally interested in a subject, because it can lead to some form of bias. So, for example, you can turn around and say, no, people aren't going to commit a serious offence because they can't possibly do it because I wouldn't. Well, sometimes we have to look beyond this, and what we need to do is we need to decide whether or not published papers about ADHD in the year 2015 are actually as informative as they could be. The issue here that anyone can really see is that a lot of the diagnosis criteria for ADHD, ASD, or anything on the continuum or the spectrum is 20 years out of date. From what I have seen, for example, with the DSM-3, the DSM-4, and the new DSM-5 that was done more recently, is that they neglected to understand that ADHD continued into adulthood. It was very difficult in that case then to accept an adult going to a GP or otherwise saying that they were hyperactive, they were running like a motor, that they couldn't concentrate on everything, that everything they were doing was creating an environment at home that made people think that they weren't interested, that made people think that they were depressed in a way. And so they'd be on a way off down to doctors and they would be diagnosed with depression, given antidepressants, which would mask any symptoms of any issues. The problem being, in this regard, ADHD, ASD is masked by many other conditions that have been diagnosed, such as manic depression, paranoid schizophrenia, bipolar disorder, generalized anxiety disorder, post-traumatic stress disorder. All of these disorders mask exactly what ADHD is. In this project, what I intend to do is follow up research that has been undertaken by different psychologists, doctors, services that help and aid in the treatment of and the possible prevention of ADHD. The only avenue I will not be following will be Autism Speaks. Unfortunately, this organisation is one that claims that ADHD is curable, that you should be aborted at birth if there is a possibility that you have got ADHD in any way, shape or form. So if it runs in your family, because ADHD is a genetic anomaly that travels through. It's also an anonymous a thing where they turn around and say, no, you're ADHD, but you're not. So if you're a girl, you can't have it. If you're a boy, it's obvious. Now this log, so to speak, will be a short guide for myself as well as for anybody else who may be interested in how I managed to come to the conclusions I'm likely to come to within my presentation. And the question I was wanting to ask was, is crime and deviance a suitable long-term project? And after weeks of trying to decide upon either self-esteem, gambling from a psychological point of view, and also ADHD, and its causes from the same angle, I've drawn the conclusion that to analyse crime and its possible relationship with mental health from a sociological point of view would be preferable than to psychological. The question is, are you more likely to commit a crime which is serious or violent if you have diagnosed or undiagnosed ADHD?